Bloomfield Hills, Michigan. So welcome to another very interesting Facebook Live. So this is a nice young lady, 37 years of age, 37. So she got her implants in 2010. So this was 16 years ago. What's interesting is a couple of years or so ago, she ended up getting a chest x-ray, and that x-ray picked up what was a ruptured implant. Now remember, the x-ray is not supposed to, but the radiologist was very complete, and he mentioned that the implant on the right, on a chest x-ray, it showed it was ruptured. This patient then ended up getting an MRI only to show indeed it was very much ruptured. And so the patient came to me with grade 4 capsular contracture. That means very hard like a rock. And this is a contracture, as you will see right here, looks like an egg. So 100% total capsulectomy, 129/26 initial CRP. You'll see the right side end block, the gold standard, complete removal of the entire implant capsule. And as you will see, look at this oval shaped pattern and hard, literally sitting on the upper part of the chest and displacing that breast tissue down. Now, if this is hard like a rock and kind of like a round ball, if you will, on the left, it's literally flat. And she also had a contracture on the left side, and you can see, relatively speaking, how different this looks. And so end block, the gold standard, this was below the muscle. So as you will see imprints of what is the cartilage right here. So this is, believe it or not, cartilage that was on the rib. And I'm going to go ahead and cut this open, and we will see this is where the whole purpose and essence of the surgery was achieved, where none of this spilled into the chest. And relatively large implant, very large implant for the patient's chest width. The other thing I want to highlight here is I can go ahead and put this, how thin is this capsule? No matter how thin, you can see literally it's diving into the implant, and none of this nice, very good, safe gummy bear implant is exactly what I said is not. It is not cohesive. It is liquid. It is disintegrated. None of this spill into the chest. No need for drains. No need for this lift on this patient. And you can see completely disintegrated. And for some time, at least from when the MRI was or the X-ray was, and this goes to showing you, do you want this spilled into your chest? Is this cohesive? Is this nice, safe gummy bear? And I challenge anyone to say this is nice and healthy and good for your body. You know, the textbook says, well, the implications of a ruptured implant are not well understood. I will tell you, they are understood well to me, that it does not belong in the body. That's why they say get an MRI at year 3, and then every 2 years they're onward. So if I look carefully here, hopefully I'll be able to make out 492 allergan implant. And if you will, look at this. So there is a liquidy component to it. Is this cohesive? Absolutely not. And this goes to showing you the shell is made up of a different material, the inside is different, and you saw this liquid honey, if you will. And implants are not lifetime devices. Not my words, these are the words of the manufacturer, the FDA. These were supposed to be the nicer, better, safer implants, and as you can see, they literally are not what they were sold to be as. They need to be monitored, as is very clearly stated by the manufacturers, and that they do rupture. So the left one, as you can see, different, overall thin capsule. Again, the precious volume was very much preserved. So if you look at this, this is very important to note. If this is the nipple areola complex, here is the breast tissue. And this is what I call P1, breast tissue. Here's the muscle. And this is P2. This is where the implant is. I'm always in this P2 level, below the muscle. I do not go into the breast tissue at all. So this is where the whole surgery is being done, at the P2 level. I like to kind of give the analogy here is parking level 1, parking level 2. I'm always at P2. I never go into P1. So I never cut around the nipple. I never cut up and down, especially in this 37-year-old lady. I'm always below in the P2 level. So the breast tissue, again, is preserved when she gets her mammogram. She's not going to have any alterations in and around in the breast tissue. And the entire capsule has been removed. So there is, in the P2 level, there's really nothing there except for the implant and the capsule, pec minor, and the ribs. So there is no precious volume removed. So as I cut this open, look at this. The slime is over me. Okay. As you can see, relatively thick. Look at how nice and good and the nicer, better, safer gummy bear implant. And it's only a matter of time before this becomes this. So overall, not much fluid in the back. Normally we have seen this. But if you look at this leaching of the silicone. Allergan 492, just like this one and just like the patient said. Look at how nice gray, silver, white this is compared to this yellow, disintegrated, blown up implant. Cohesive, nice, good, sold as safe. Eventually will become this. It's only a matter of time. They're not going to be gummy bear forever is what I'm trying to say. And as you'll see, look how thin the capsular tissue is. No matter how thin, it has to be removed. And this is where the entire capsule must be removed so that, God forbid, if this was ruptured, none of the silicone would have spilled into the chest. So the bottom line here is implants are not lifetime devices. The longer patients have them, the higher the chances are they're going to have problems. You want to always do the end block because you don't want this to spill into the chest. You want to always remove the capsule so that we can send it off to pathology to make sure it's not that very rare BIALCL, the very rare BIASCC, which is the breast implant associated squamous cell cancer, breast cancer, anything abnormal. Cultures for aerobic, anaerobic, and fungal. There was no fluid, so no cytology specimens. Implants will be returned to the patient. Everything contained comprehensive, complete, definitive removal and complete workup, so the patient knows what it is. She had that grade 4 painful contraction on the right, as you saw. We will see how she's only going to improve, minus what are these very large implants for the patient's chest width, minus the inflammation, minus the weight. She certainly was not a candidate for a breast lift. The pseudo, I did not even cut out the excess skin, as you see at the bottom, because of her young age and the way how the implant had displaced the breast tissue down. And I'm overall very happy and content with how the whole dissection has gone, and we will hopefully hear from her as to how she has only improved. One thing I want to mention, patients that have implants only complain of problems, i.e. they have eventually, not all, some patients will complain of breast implant unless they will complain of a rupture. Many patients have come my way and they had what is a silent rupture. Silent rupture means that they have a ruptured implant. Exam looks excellent, and now guess what? They get an MRI, and lo and behold, to their total surprise, an incidental finding of what is a rupture. Or when you replace implants, you find that there is a rupture, and it is not healthy for this to be spilled into the chest. No matter how much you clean or wash the chest out with fluid or put drains in, you cannot wash the slime off. As you can imagine, if you have had slime on your hands, it's very analogous to that, and you wash it, you're only going to spread the badness. So the bottom line here is, do your homework, do your research if you want to get implants, so you know what you're signing up for. So if you're interested in that Motiva, nicer, better, safer, 6th generation, newer, micro-textured implants, they're going to end up in the same category right here, and they're only going to be bad eventually, sooner or later. If you want to get an explant, you want to make sure you want to have done your homework, because you do not want to be basically in a situation where the surgeon is dissecting and now you're shortchanged and this spills into the chest and the surgeon is taken by surprise. Well, they were supposed to be gummy bear and they certainly are not. So there you have it. This is Dr. Khan, Executive Plastic Surgery.